So good morning, everybody. Really nice to see so many people across the country once again. It's really thrilling as we sit here in soggy Vancouver, truthfully. Nice to hear that other people are enjoying the summer and sunshine. So again, welcome. This is our second session in talking about recovery-oriented PSR practice. And this particular session is about assessment. So hopefully you're in the right room. Welcome. And just to let you know that this is presentation by BC Advanced Practice. Today it will be myself talking to you a little bit, so you know that I'm part of the Advanced Practice team, and I come with you from a background of occupational therapy, involved here in the School of Occupational Therapy, Occupational Science, co-president of PSR Canada, and a new member of the PSR Canada Education Committee. And really my interests lie in the experience of people who live with mental health issues, their family members. I'm interested in enhancing clinical practice, engaging in systems transformation, education, research, and policy development. And we have the great pleasure to welcome today Mr. Darren Weep. Lovely picture, Darren. Darren is a psychosocial rehabilitation practitioner with Stepping Stones Community Services Society. He has a background in training in early psychosis intervention, as well as motivational interviewing, employment supports, and collaborative care. Having recently completed his postgraduate diploma in psychosocial rehabilitation at Douglas College, Darren speaks from a place of experience grounded in quality education. Darren is excited to be able to continue pursuing his passion within the mental health field by furthering his education, and I think he'll probably be okay with me telling you that he's just been accepted to occupational therapy school here in British Columbia. So a big congratulations to Darren, and we're deeply appreciative for his contribution today. So thanks, Darren, and welcome to you. Some of these faces I think you'll remember from past presentations, but we thank Jordan Clark for his technology support. He's the person who helps us put things on the website, helps us with evaluations, helps us making sure that our technology is running smoothly. So thanks, Jordan. To the right of that is Matthew, who is also to the right of me here as I sit in the room. And without Matthew's amazing help, we would not be here this morning. We had a few technical excitements at the last moment, as usual. So thanks kindly to Matt. On the left-hand side, you'll see Dr. John Higginbottom, whose brainchild this whole thing really is. So a big thank you to John for his continued commitment and his support and his vision. So thanks, John. And then you see a picture of myself here on the right. So with that in mind, we're just going to over to Matthew, who's going to help me pull up the slides for this morning. So I'm glad to hear that Jill says it's a beautiful day in northern Alberta. As I mentioned, it's a pretty soggy day here in Vancouver. And there we go. I'm just going to start sharing my webcam, which is always a scary experience for me. So let me just focus the camera there a little bit. All right. So hopefully you can see. And let's move into talking about applying recovery-based services through an assessment. So I know that for many of you, a lot of this material may be a review. And the reason that we're doing these person-centered care and assessment is really to give some core background on those core basic skills, which was some feedback that early participants had told us that they wanted to hear about on these educational sessions. So just to take a quote from Mike Slade, who many of you probably know from the UK, he says, "The development of personal meaning is central to recovery, but few find anything fulfilling in the role of mental patient." So I think that kind of situates us well to begin to speak about assessment. We add that the assessment process is an opportunity for meaning making, and let's just keep that in mind as we move through this material. Just want to also add that assessment can indeed be a challenging process for those of us delivering the assessment, and for those of us sometimes receiving the assessment, it can be somewhat intimidating, can't it? And it can just remind us of perhaps past losses or you know, just the things that we're not doing well. PSR lens, however, really helps us understand that people have the capacity to engage fully in the assessment process, and that's not always, I think, the mantra in clinical practice, but that is certainly what the PSR lens brings to us. And just a reminder that indeed assessment is linked to the competencies of performers, indicators of new PSR competency practice, in particular point D 4.2 that speaks to clinicians about having the knowledge and ability to apply strength-based assessment approach to assessments, integrating physical, psychological, social, cultural, and spiritual individual to develop plans. So with that in mind, knowing that this information is situated both in PSR literature and recovery literature, and certainly front and center with our Canadian PSR competencies, I just want to move to a piece of acknowledgement of where, at least from my presentation, a lot of the information I took from clinical practice and also a recent publication by the Psychiatric Rehabilitation Association, and in particular one chapter by Pitts and Hayes in that particular publication. And I've adopted this presentation from one I did for Frontenac Mental Health and Addiction Services. So our learning goals today really to identify unique value of strength-based assessment, describe best practices, challenges and concerns related to assessment, apply the strength-based assessment process and 2 tools to a case study, and identify how this particular webinar is going to hopefully and positively influence your practice. To give you a bit of an outline of this particular session, we'll discuss the rationale, different approaches to assessment. We'll discuss the processes and values, philosophies that influence PSR assessment, outlining some of our challenges, articulating best practices, and then we'll hear from Darren as he applies a particular case study to 2 tools, or portions of 2 tools, which we hope will just really ground this presentation for you. And then it's over to you to ask you how you might apply this information to your practice. So I know we make you work hard, but it is really, I'm of a firm belief that many of us, we attend a lot of educational sessions, but really trying to apply that to practice, I think, is the gift of having time out to think about our learning. So again, back to Mike Slade. And this, again, this quote just really helps me, I think, situates this presentation. And I'll just read it. The process of recovery normally starts with the quest for meaning. Meaning making, sense of what has been and is happening. Many people will try to reduce anxiety by wanting an answer from the mental health professional, and I expect many of us have been there. Therefore, part of the assessment will involve collecting enough information to be able to offer a professional perspective. The professional view about what diagnosis should certainly be shared, but he says there should also be attentiveness in how it is used in the assessment process. It is really a resource to offer to the user, not the answer. And for me, this quote really captures 2 things. The first of which is just the idea of meaning making, and the idea of meaning making within the assessment process. And the other is the notion of professionalism within the assessment, such that we're not the expert, but rather the client is. And in that collaborative process, we are bringing, the professional are bringing their expertise, their learning to that relationship and that process. However, that client is really directing the process. So assessment process becomes about developing hope, not just capturing information. Assessment process can be transformative, but it really does have to make sense to the user. And I know I'm probably speaking to the converted, but I hope that that just overview helps us situate our work together this morning. So I'm going to ask you some questions. For those of you who've been in one of these before, sometimes I ask you to type in the type box. So I'm going to ask you, what do you think is the value of assessment? So really, what's assessment all about for you? What's the good thing about it, or what's the challenge? But really, what is assessment about for you? So when you get a chance, if you can just please type. I will try to respond to them. I will likely miss some, but just I would like to get your ideas about this. I see some people are typing, so I'm just going to give you a moment. And I'm asking, what is the value of assessment? taking a moment. Text is a little bit slow today. Well, people are typing, but I don't see anything. That's because I haven't scrolled down. Is that right, Mark?
I'm not sure.
I silly.
Yeah.
I apologize. Here I am waiting for the wrong thing. I apologize. All right. So people say identify what's important to the client, media to engage, empower the client of active participation, determining what we already know, puts the client in the center of planning. Thank you, Sharon. It brings value in that it sheds light upon the person. Absolutely, Stacey. Yep. So thank you for that. Really, I think assessment is the first step in the intervention. It can be formal or informal. It involves the process and it informs the tools. It should be planned as an intentional intervention and should be able to document changes. And as people have mentioned, that we may modify the process as we go along. Really needs to set the tone for the intervention and understand the client's views of their recovery goals. I see some more people typing. Good baseline to work from, understanding a person's experience, building a relationship and trust, absolutely, with family. Thank you for adding that. Learning, understanding, developing partnership, identify priorities, a chance for the client to share his or her story and priorities. To give me some information I can find, it often provides valuable information for the individual as well. Thank you for that. Helps us guide, support the plans, etc. It's an integral part of, there's James, hello James, part of creating awareness. It demonstrates whether or not goals, objectives are being met. So fantastic ideas. Really, I think what we're saying is it establishes a recovery-oriented PSR approach, that assessment is an ongoing process. It's collaborative, can be interprofessional, involving the family. You've already said that. It can also be used for gatekeeping, could be an opportunity for sharing, learning and growth for practitioner and client, and you've said that. Assessment helps people know about their function and help transition to natural supports to modify rehabilitation plans. So I think you guys have covered everything that I had put together. And just a reminder that every contact is about building rapport and mutuality in the interaction is an essential in assessment for living, learning, working environments. It also provides an opportunity for personal responsibility taking and meaning making, as Dr. Slade says. So good work, you guys. I think you've articulated well what is the big deal about assessment. So we're, I think, concluding that assessment is pretty important. So the next slide really asks about unique aspects of a psychosocial rehabilitation approach. So from your perspective, what do you think is unique about a PSR approach? Scroll down, Matthew reminds me. Very good. Thank you. Confirm what a client knows about themselves and their knowledge about themselves as well. Thank you for that, Annie. Yeah. Provides focus, addresses strengths. Yeah. Knowledge, strengths, challenges, needs of the individual. Most important part of the OT process, Patricia says. Focus, knowledge, tells us what the client knows and wants. Stacey speaks about the uniqueness, more holistic assessment. I like that. Hope looks at a person. So here we're speaking, I think, about PSR approaches as being much more unique. And when we read out the competencies for PSR practitioners, what we're saying to ourselves as PSR practitioners that more holistic assessment is essentially a psychosocial rehabilitation assessment. Stacey adds that, I've lost Stacey. Oh dear. Signs in charge, forward moving, relationship is key, less emphasis on signs and symptoms. Thank you, Sharon. Client led, potential for growth, talks about their values. Strength and limitation and how they view themselves. Right. So I think here we're saying that PSR assessment should be individualized, way to get to know the person and how the illness has impacted their lives. Seeking mutual agreement on functional strengths and environmental supports within the daily life context. seeking mutual agreement on needs, skills, and supports, and individually tailor the support. Helps the person to consider their sense of satisfaction and efficacy. So here we're getting to a place of really rehab readiness, but helps us to consider the sense of satisfaction and efficacy. I'm just going to go back to the comments here for a moment. Here, the person's need for growth of independence, excellent, makes clinicians collaborative with each other, right? Because we have to speak to each other. Sharon, welcome. Know about the client's strength, limitation, and how they view themselves right now. Great. Just want to make sure that I've captured all your comments there. Okay. Yeah, so helps the person consider their sense of satisfaction and efficacy. The aim of the assessment is to support recovery, isn't it? The specifics of a PSR assessment is to consider rehabilitation readiness and preferences for change in 5 areas to help us to track the change, and they help us determine eligibility for assessment. We know that as assessment best practices have evolved over decades and draw from work from various disciplines, including counseling, psychology, OT, social work, psychiatry. Yeah. So I'm just going to go back, make sure I haven't missed any comments. Okay, excellent. All right. So in this section, we began to talk about specifics of PSR assessment. We began to talk about rehab readiness. We're going to speak some more about that. So we'll just flush out these ideas a little bit more. Cheryl adds, we have a major echo on the sound, not for my ideas. Matthew's just he's thinking about that one. Linda says, identify the client's personal strengths and skills. Thank you, Linda. Okay, all right. So, we don't have a way for people to click and say yes or no, do we? Okay. So if we can just ask you to find the icon, and I'm just going to ask people if they were present at the last session, the person-centered planning. So Matt is just nodding his head here. So we're just going to, yeah, thank you, Matt. Present at the last PCP. One person, thank you, Loretta. It just gives me a better sense of what to say about this particular slide, so I appreciate that. Thanks, Matt. That was awesome. I was in the moment, Matt. I'm impressed. Oh, this is great. I'll just give it another moment or 3. Great. So I think just broadly, we have about 23 or 4 people who were present at the last PCP presentation. Let's go back to our slide that we made. Thank you, Matt. So that just gives me a 20 we pulled out of there. So that just gives me a really good sense. And the reason that I want to pull that back is that I want to talk a little bit about person-centered planning. So I'm going to try not to repeat too much for those of you who've heard this before. If you haven't heard it, you want to hear more, please remember that that presentation is on the PSR Advanced Practice website. So you feel free to go in there, and there's an audio and visual. But really, person-centered planning, I need to forward my slides here a moment, involves an ongoing collaborative process of change regarding roles and relationships and outcomes and documentation based on self-determination, community inclusion, and strength-based individualized service delivery. So I bring that back because I heard in our comments very much people saying that it's about a collaborative process, it's about the client being in the driver's seat. So I know that, again, that you guys know about this. And just a reminder that Tandara talks about 4 different aspects of person-centered planning, of philosophy, process, plan, and product. I really think that that overarching philosophy of person-centered planning can lend a lot to how we think about assessment. So here in my next slide, you'll just see that from my perspective, I see it as that overarching philosophical centeredness that helps us walk through the assessment process. In this slide also, I just pulled out 2 things. One is a specific strength-based assessment, and the other is the assessment that includes the PSR process readiness strengths. So this assessment approach are not mutually exclusive. So my understanding is that PSR really includes and appreciates that strength-based approach. However, work from RAP and GOSHA really focuses primarily on that strength-based approach. So sometimes we read this in the literature, and from my perspective, it can be a little bit confusing, truthfully, but it just gives us a sense that there may be two approaches to this, and so if you're interested in reading around it, this may be helpful to just pull that out. I think it's also important to recognize that different professional approaches occur within different professional institutions. So we all come with our own worldview and our own skills and our background and our favorite assessments or our favorite way of thinking about things. And from my perspective, just that self-directed care can provide a really sort of a flagship to help us think about how to think about assessment. So I hope that's useful. It took me a little while to figure that out, but I hope that's a useful way to think about it. Here, this is work by Tandura et al., where she thinks about self-directed care. She thinks about the goal, what that person's working on in their own words. I've seen, and I've done this myself, made goals, and sometimes it's not in the person's words, it's in my words, but it's just a good reminder about goal setting with using that person's words. Thinking about the strengths, for example, the skills, abilities, talents, and past experiences. Thinking about some of the barriers that may interfere with accomplishing goals. And the objectives really being the smaller steps that help the person accomplish the bigger goal. And again, in the person's words. So really important to think about that. And then interventions, actions by the client, provider, and supporters that take to help accomplish the person to meet their chosen goals. So this little visual just really helped me situate and think about things from a broader perspective. And I hope that that's a useful little slide for you. So the first piece I talked about was the strength-based approach by Rapp and Gosha. Of importance to notice that the Substance Abuse and Mental Health Services Administration identifies strength-based approach as one of the 10 components in recovery. So earlier on we spoke about competencies through PSR Canada. Now we're just indicating that SAMHSA, big large organization in the US, is concurring that, also lending weight, I think, to this notion of strength-based approach. Knowing that Rapp and Gosha's work has been around for 30 years, and in truth it's only recently being empirically tested. So that's, I think, an important aspect. The next slide just really speaks to, the power of strength-based assessment, that it's intended to be provocative. So rather than looking at just the deficits, we're really trying to look at things from a different perspective, to give, as one person already mentioned, to give a holistic picture of a person's talents and skills, aspiration, environmental resources that are presented or have been present for the consumer across 7 domains, such as home, daily living, assets, financial, insurance, employment, education, specialized knowledge, supportive relationships, wellness, health, leisure, recreational, and spiritual, cultural aspects. So they're the aspects of a strength-based assessment that specifically Rapp and Gosha pull out as being important. And this next slide just gives you the source for that in case you're interested in following up. Rapp and Gosha have indeed done a lot of work with strength-based case management. So now I would just wanted to move into the more formal psychosocial rehabilitation assessment process. And this is work that I've really adapted from Farkas and also from Pitts and Hayes. So it speaks about assessing rehabilitation readiness. The assessment process includes exploration of indicators. So we'll speak more about that in a little moment. But really, I know that many of you know this information, but just identifying that need for change. Asking about a person's success and satisfaction with their current life situation. Considering a commitment to change. So identifying the extent of commitment that that person has to their desired change. Personal closeness. And I think as clinicians, sometimes we truly underestimate the power of our ability to support somebody through their change journey. But that personal closeness, the extent of the openness to connecting with others, and oftentimes with their clinician, knowing full well that sometimes we may not be the best person to walk along that change process for everybody, but just offering people the opportunity to decline service with us if that's not going to work for them, and to support them in choosing another clinician who may be able to work with them. But just acknowledging that that personal closeness with others helps people tremendously in developing readiness and opening the doors for their own change process. And of course, that assessment really helps people, as you've said in your earlier comments, develop a deeper sense of self-understanding, of understanding what's important to people, of understanding their wishes, their hopes, and their desires through that assessment process. And finally, developing environmental awareness, awareness of what's in the environment, of what could be supportive for them, of what they like or dislike. So they're just the 5 aspects of developing readiness. Assessment is needed to plan and facilitate behavioral change. Readiness is a reflection of the consumer's interest in rehabilitation and self-confidence, as opposed to the capacity to do a task or complete rehabilitation intervention. Now, that's a direct quote from Pitts and Hayes in 2014. And I think it speaks beautifully to the notion of really it's about self-confidence as opposed to capacity. And as we help people develop their own self-confidence, we are implying that there is an increased capacity to be able to complete the rehabilitation intervention. So if we walk away with a key message today, I think that what we're saying is that assessment contributes to the development of readiness in that way, in developing sense of confidence, sense of efficacy. The assumption that readiness can change over time in response to the environment or to internal factors. There's another assumption that the fact that the person may want to work in one area of their life but not others, and may, for example, want to work in, say, for example, the area of school and perhaps not the area of self-care. So really helping that person make that choice is essential. Cool. So how are we doing? You guys with me? How are we doing? Just check in a little bit. Maybe I'll just ask if there are any questions in that process. We'll take 1 or 2 questions if anybody has one. I don't see any questions for now, so I'll just move on if that's okay. If you have one, Matt, my trustee support here, will keep an eye on it and make sure that I'm doing the right thing and answering them as best I can. So these next slides are really asking, how do you go about assessing readiness? So we know what the 5 components of readiness are, but how do we go about that? So one way might be to use a reflective dialogue that draws on motivational enhancement. So, for example, I'm going to make you work now. John has made an appointment with you to consider his employment options. He's a 22-year-old man who lives with his parents and has a diagnosis of schizophrenia. He dislikes his current part-time job as a waiter. How would you ask him about the need for change? So I'm just going to take a few comments. I'm going to ask you to type. How would you ask John about this? See, a couple of people are typing. Just going to take a moment for that. Where does he see himself a year from now? And James says that's the notion of projection. Welcome, Elsa. So nice to see you. Not a problem. Good you're here. Susan, sorry I missed you. Ask him what he dislikes about his current job. Good place to start. Mary says, ask what he would like to do, what his dislikes about his current job, what is his ideas. Don says, ask him about his goals. Excellent. What does he like about his current job? Thanks, Diane. Yeah, so we see we're coming at it from what's not good, what is good. Good. What's his dream job? Nice, Kathy. Yeah. What have you learned from your current job? What a great question. I like that. Thank you, Sharon. What would you like to change now? Very simple question, direct. Yep, like it. Yeah. Yeah. So I'll just move into some of the ideas that I had and then I'll come back. So before I do that, Stacey said, ask him if his current job will support him and achieve his future goals. Wow. What has changed, Lise? That's such a nice, simple, what has changed for you? Lovely. So you might ask him about how to satisfy his current situation, ask him to describe what he dislikes, what has been successful for him in employment in the last 2 or 3 years. Ask him to make an inventory of the skills he has and perhaps identify what he has done already to learn about options. What would he like you to do or to know, and how could you help him plan? So really the goal is to help the person to consider his or own life in a sensitive, skillful way, promoting trust and safety while being aware of power. We'll talk about the power issue a little bit later, but Connie says, if he doesn't like his current job, ask him what his plan or idea in mind. Good. What would be a comfort job for him to feel better? Nice, Donna. All right. So we have some good ideas about how we would begin to ask about readiness. I'm going to move to the next slide. Another approach you might use is sort of a reflexive phenomenological interview process, asking the person to tell you about it in his own words, so you have a better understanding of his actual experience. How would you do this with John, do you think, as you assess his personal closeness? How would you ask him about that? Yeah. Michael says what he likes best to do and his capacities he can leverage. Nice one. Thank you, Michael. Awesome. Yeah. Any other ideas that we might have? Yeah. What do you like best? What do you like to do best? Great question. See, Joyce and Connie, you have some ideas here. I'll just wait for those. Where's your happy place? Nice. I like that, Donna. Yeah. What do you enjoy doing? Ask him to describe a typical day at his job. That's cool, Doc. Yeah. I think you might ask John what's important in his life, who helps him, who does he listen to, who supports him perhaps. What are the characteristics about people who help him, and what are the characteristics of people who do not help him? You might ask him how he came here today. It may give you a sense of asking him about employment options, or the idea that is the idea of he coming here his or somebody else's. Likely which share what kind of intervention you could do to help him, and ask him if he is happy to work with you or would he wish to work with somebody else. In this respect, you might ask a client to rate their experience of your performance using a Likert scale. How was this intervention from you on a scale of 1 to 5? So, was I helpful, not helpful? And if you're interested in further information on that, I suggest you have a look at Miller and Rodnick for additional information there here. So just catching up with the chat here. What is your past job experience? What do you want to change? How did you best learn? That's a great idea, Cheryl. Yeah. Ask if there's a sense of urgency. Have you had feedback from present employer? Nice, excellent, practical question. What is your experience of working with others? How do you think about doing what do you think about doing while you're at work? Okay, so it may be a change place for him. That's a good suggestion, Stephen. Great. Okay, so oh, pardon me. Thank you. Excuse me. All right, so let's move to the next slide that begins to speak about values, philosophy related to power and reflexivity. So I would like you to think about how power is seen within or experienced within that therapeutic relationship. So I'd like to ask you to just take a little moment and maybe type. How have you maybe experienced power? How have you considered power from the other person's perspective? Let's have a little chat about power in assessment. You might even think about what strategies you might use to shift power. You might think about why is power important. I see multiple attendees are typing, so client is an expert, so yeah, that's good. You may influence job satisfaction. Okay. has self-control and feel valued as a human being. Oftentimes, service providers are deemed as a person with knowledge and the power, Michael, absolutely, rather than the person receiving service. Thank you for bringing that up. There's power differential that is clear to the client. Shift power by reminding them that they're the expert in their experience and you're trying to learn from them. Superb. Susan adds, client has the power. We want them to be empowered. Client is the expert. Power should be between the client. Respect the client's choice, even if they may not seem like the best choice. Power issues are always present and absolutely, and therefore need to be brought to the open, supporting the client in understanding and taking control back. Fantastic. Setting the atmosphere, meeting in a comfortable place, facilitating open, oopsie-daisies. All right, so I've moved into my next slide by, I didn't need to do that, but that's okay. Studies, I do want to just finish that slide by saying studies show that the therapeutic alliance, sorry, that's my dog in the background. Poor man has to quieten the dog. Poor guy, multitasking. Studies show that the therapeutic alliance is the aspect of the therapeutic intervention that makes a difference in outcomes and satisfaction for clients. So I should be good now. Sorry about the dog. So my next slide really helps us, I think, a little bit more about, and I think you started talking about this in the chat box, where the assessment occurs, sort of the socioeconomic issues that may influence power and how it's played out in the interview process, such as gender, class, poverty, sexual orientation, race. Understanding why is the person with you? Is it really their idea or is it somebody else's idea? Understanding that fatigue, cognition issues, and that may impact power sharing. I'm smiling because my dog is here and she's trying to be quiet, sorry. Understanding the experience of trauma, past or present, and that the person may be hearing voices and ask about the relationship with the voice. So I guess this slide is just intended to say there may be multiple issues about power present in the room. Gisela brought up that power is always present, absolutely true. Anything surprise you maybe in this slide? Anything that I'm missing? I'm just going to look through, shift the interview to the client asking questions. Good plan, Sharon. Clients often unwilling to readily accept a medical model of care with which they are unfamiliar. So that may mean just throwing off kilter in terms of power, absolutely. Part of the power and reflexivity issue, maybe, Michael, you're funny. Does the client want to be self-sufficient, or is it the parent's idea he should be? Absolutely, Cheryl. Person may consider the voice has all the power at times. Person may consider the voice has all the power at times. That sounds really good, Sharon. I might need a little bit more detail about that comment if you have time. So maybe the person speaking has the power, perhaps. So I guess here we're just trying to highlight that power is essential, and being reflective of our own power, auditory hallucination. I thank you, Sharon, for that clarification. Absolutely. So the person may be deferring to the voice to maybe it may be more important. Thank you for that. It takes time and patience, not a one-off assessment. Thank you, Jason. Absolutely. Right. So power plays out in various ways, and practitioners need to be aware of their position regarding gender, socioeconomic status, and sexual orientation or race, considering the aspect of trauma, fatigue, and voices, understanding that the relationship between the voice hearer and their voice is a social relationship, and so issues of victimhood, power, fear, and empowerment are valid assessment topics. So that doesn't come from me, that comes from Mike Slade, and I think it's really an important aspect of just the voice hearer as well. I'm going to check in with some of the comments here. I just don't want to miss some of this. It takes time and patience, we said. I'm glad that you make a note of fatigue and trauma. I believe this affects the individual at a level we do not always consider and perhaps understand. Absolutely, Liz. We also need to consider the meaning of power as perceived by the client. Absolutely, Michael. Yeah, so they may be in your office with your particular personal photographs or whatever that might be. And while we think we are sometimes enhancing the environment to make it more comfortable, we may indeed be taking power by just making sure that this is your environment as opposed to the client's. Leslie said, clients may be coping with long-standing oppression. Thank you. So beautifully said, Lisa. Thank you. So I think we have the recommendation to reflect on these aspects with other colleagues in order to stay connected with your own experience and to seek the support to maintain your own wellness. And I really think that that's an important aspect of the work we do, taking care of ourselves. And it's hard work sometimes being aware of all of these issues, being present and doing a good job. And this is just to note that in this reflexive process, that being able to take care of yourself is important as well. Sharon says, I firmly consider that we have problems comprehending the barriers that people experience as their cognitive function is impaired, regardless of the diagnosis. Thank you, Sharon. Their perception of their power shifts depending on the factors identified. Fair enough. Yes. Yeah, I think, Cheryl, that's a very, very rich comment, and yeah, I wish that. Thank you. Okay, so we had a good chat about power. I'm going to leave you with some questions that I won't spend a long time on, but these come from, again, Dr. Michael Slade from the UK. But when we talk about that phenomenological interview, the narrative interview, these are really good questions, I think. I particularly like the second one. When did you last have fun? And I ended up with in tertiary healthcare yesterday. They were having a party, and they were doing some work with people receiving services. They had cutouts of footprints, and they were asking people to think about recovery and words of recovery as they're doing this creative exercise. And some people were really saying, recovery is about having fun. And I just thought that was so cool, because rarely in the conversation, I think, do we purposely bring in this notion of fun and play. And it's a bit of a hobby horse of mine. So I think that's just that notion of fun is really, I think, provides a new door to have conversations with people around recovery. So, yeah. So I leave Matt to just respond. Thank you for that around the slides being available. Check out Laughing Yoga. Thank you, Kathy. Yeah, absolutely. I did that once as a professional development piece, and it was a lot of fun, I have to say. Absolutely. This slide, again, I'm not going to spend too long on, but I just think it's precious. It comes from Dr. Mike Slade again, but it really helps us think about how the values that we have may actually promote hope. And it's rare, I think, that we really try to operationalize, helping people to find that hope within themselves. But this slide really helps us understand that, as we value the person as a unique human being, we're really trying to activate the internal resources. Sometimes I think our strength-based assessments say, well, this is what I've seen. We're that external feedback, and that's really a great place to start. But really what we're trying to do is activate the internal resources within that person, and that helping people to understand that failure is a positive sign of engagement and contributes to self-knowledge. So it's a bit of a switch, isn't it? It's a bit of a switch from thinking that, well, failure, okay, I'm done, but really helping that person learn and engage in the fact that, well, I tried, and there's a next step after that. And then accessing external resources. As a practitioner, you're trying to really target the efforts towards supporting the person to maintain relationships and social roles. So I know often we talk about family involvement, and developing hope around family involvement can be a key point of change with and for people. So very powerful. So this little slide I'm going to leave with you, and the beauty of it, I think, is really to try and just operationalize how we can consider hope as we value that, as we value it when working with people. I hope you like that slide. So what Hayes and Pitts really does that I like is that they identify, well, at the end of readiness assessment, so what? What am I going to get? At the end of a good readiness assessment, you should know about the person's goals. So at this point, we're goal setting. We know what the person's goal is. We have a mutual understanding of the desired changes. And finally, we understand strengths. So here I just wanted to tie in the fact that some assessments are strength-based assessments, and then assessments sometimes is pervasive within the PSR assessment process. So I just wanted to tie that in very purposefully, but I really like how they tidy it so that at the end of this phase, this is what I should know about. So it's a good check mark, I think, if you've done a good job. Next, we move into functional assessment. So you remember that Pitts and Hayes talk about doing a readiness assessment, a functional assessment, and an environmental assessment. So a functional assessment consists of identifying the behavioral and routines and skills needed for life domains that are targeted for change by the readiness assessment. So that's a lot of words, really. But really what it's trying to say is that it's really looking at the routines and it's looking at the skills that the person may need if they wish to accomplish their goal. And this may be in areas of work, self-care, home care, equipment, school, relationship, community, and mobility and leisure. So that's just how they've broken it down. But I think it's really helpful to think about. So I'm going to do a functional assessment. Now I know what the person's goals are. Now I'm going to move into a functional assessment. So what are the strengths? What are the challenges? What does the person need? Do we need to talk about routines of day, getting up in the morning, going to sleep at night, those kinds of things. So that's just a little bit of a brief outline of functional assessment. And I'm just going to catch up with my notes here. All right. Really asking here about past functional achievements and successes and challenges is an important aspect of this assessment. And it provides a picture for the client and practitioner of current skills, supports needed to make this successful change. On a note, I know we've said this before, but to just bring it back, it can be stressful and a little demoralizing if the client is overwhelmed and sees only a loss of function. So hence our focus on the strength aspect. Occurs after the goal establishment, requires an understanding of the person's preferences, focuses on behavioral routines and the skills needed, and the assessment is carried out in a specific context. So that may be important if we're looking at a vocational assessment, looking at somebody's work, observation, performance-based, an analysis of specific skills is needed. So just really bringing that assessment to where the person is making the change can be a very useful functional assessment. I think it's kind of important that to note that functional assessment may be influenced by motivation and the context, the specific demands of the task, and the need to understand the fit of the capacity and the performance is important, I think. What does getting to work require? Does it require memory, cognition, computing, physical skills, social skills, cultural demands, to inform the reasoning between the task and the demands, and the possible gap between performance and the desired activity or action. The person may know how to do something, but may not have the support or be unwilling indeed, or unable to perform a task when it is required. So just matching the demands and the skill need is important. And just spend a little moment talking about cognitive assessment, and I will refer you back to one of our webinars in March, I believe it was, with dear Kathy Wong, who did a wonderful presentation for us on cognitive assessment. If you're interested in that, please do look at the PSR website. But already we've mentioned this in the text, that essential focus on this topic in recent years. And really the idea is to help link cognition with function. And the key is to have an understanding of the cognitive physical demands of a desired behavior change in order to plan for success. Identifying what cognitive and physical demands John, for example, may require if he wishes to apply for a new job as a sales assistant within the Home Depot department, just as an example. So again, drawing on work by Pitts and Hayes, the outcome of functional assessment is really to understand the fit between the routines and support the participation in desired roles, so knowing about the habits and routines and skills necessary. Understand the efficacy and the consistency of the performance. So understanding that person is able to get to work on time, the consistency, understanding the person's preference and values, and identify for skills and resource development. So I think that's a nice little clean package. These are the desired elements of the outcome of a functional assessment. Now finally, we're just going to look, I hope, at assessing environmental resources and barriers. Involves an ongoing assessment of environmental aspects that may help or hinder a person in making their changes. For example, access to family, other people in the community, access to support networks or groups, to services, maybe even transportation, to the physical ability needed, and to finances. So really thinking about those aspects of the environment that can make or break a change, and just understanding the person in the context. So for some, a particular environment may be more important than others, but just having a good sense, knowing that community. Also, in terms of practitioner, you knowing your own community will help match the person with the required support. Cultural considerations will influence environmental aspect of the person's experience, i.e. their values regarding how they wish to and are required to participate in valued roles. Use of space, allocation of time for recreation. So I'll just leave that there. But knowing that at the end of the environmental assessment, you'll have a good understanding of the person's experience of the environment and the barriers and the strengths. So not necessarily only what's out there, but understanding the person's experience of the environment and their own barriers and their own strengths. Understanding the person's routines and habits, and know how the environment influences their role enactment. Does the person have access to the community centres for valued activities, for example? So here are some specific assessments. I'm going to leave them with you to let you know that's a bit of a crowded PowerPoint, I'm sorry, but that last one, Darren is going to walk us through a piece of that, the client self-appraisal of needs as an assessment. So he's going to walk us through that, and just for your reference, there's some other assessments there. A little note about choosing assessments, just thinking about, are those assessments really relevant? Are they feasible? Do they have good utility? Do they have evidence-based? So consulting with others, really, I think the best way to identify a good assessment. So is the tool relevant, specific to the person you're working with, relevant for this person's values within the context? Is the tool accepted by others? Can the tool be used within your setting? The time, the cost, the training, and the equipment, how is that? Will the resulting information be useful? What's the benefit to the tool? Who benefits from the outcome? And is the tool grounded in theory? Does it have reliability? Those kinds of things. So those are some of the aspects in considering assessments. I'd like to ask you a little bit about what might your challenges be in terms of assessments. I'm trying to take that slide away. Not enough to ask a question, need to see the functional ability. Cheryl, thank you so much for that. So I'm just going to ask you to take a moment or two so I can pass you along to Matt soon, to Darren soon. But what are some of your challenges with assessments, please? So I'd just like to hear a few words from you. Not be the best. Of course I can go to school, but in reality, we struggle to get out of bed in the morning. Hard to take. Yes. Sharon, I'm just going to comment on that while people are typing. I think that's really what Pitts and Hayes talk about, really trying to understand the gap between that sense of self-efficacy sometimes and that, you know, that function, what really happens for the person. And I think really trying to bridge that gap and understand the why. And, you know, I don't want to, I'm going to foreshadow, I think that's the right word, but when Darren speaks to us about his presentation, I think we'll be able to see exactly that concept there. Sometimes we meet a bit of a barrier and we're not sure why. So I think Darren will help us think about that some more. So thank you for that question. And if you wish to bring that question back, feel free to at the end. Thank you. So lack of education, Dave highlights, our agency encourages in-office assessment as opposed to real-world assessment. Lack of focus, not all questions apply to clients, and this can frustrate them. Yeah, I hear you. Michael says, identify clearly the objectives, the assessment, my objectives, client's objectives, so separating all that stuff out. Self-reported behavior, not observable behavior. Yeah, I hear you. So sometimes there may be a gap, but I think also just genuinely, I think as we do respond to a person saying that this is what I do, and then really helping them develop awareness around that if there is a gap, is a skillful journey with people. Barbara says solely paper-based, a lot of interviews missed. In-person interview makes a considerable difference in the accuracy of the assessment, as does client history. Thank you for that, Barbara. Yeah. Real-life contracts versus contrived environment. Absolutely, Michael. So I guess we're advocating for bringing those assessments into the real-life context. Thank you for that. Yeah. So I'll show you what I prepared, and then you can tell me if you think this is reasonable, but often we need training, don't we? Assessment tools are often specific to organizations. I think you've already said that. James says, well said, Michael. Self-awareness varies greatly in emphasizing with cognitive dissonance and how to move forward. That's a dense comment. Joyce, thank you. That shows, I think, a little bit of the complexity of the assessment process. Challenges to do large-scale research using non-validated tools. Specificity of tools is not always clear. Like you said, sometimes the ideas don't relate to the person you're working with. Documentation should involve clients as much as possible. Often overlooked is involving the client in documenting process, goals, and progress. We've said that before, and we cited Janice Tondora several times for saying that with copious research. So I think we really do need to take that to heart. Progress of the person and their successes regarding change and willingness to engage in rehabilitation. Progress regarding your own ability to do good dynamic system. Oh yeah, okay, so sorry, I got a bit confused here because I flipped. I thought I was being creative there, but anyways. So Kathy says provide need to learn to be curious about people they work with. I think sometimes in organizations, Kathy, we're very busy, right? And let's get the job done, and there's sometimes a little bit less time to think about what might be the best assessment and so forth. So I absolutely agree. Mary says clients being resistive, mistrustful, difficulty to attain it, poverty of thought, paranoid. I hear you, Mary. I think our challenge is really to find a way to really just engage with the person. And people have said earlier on that, sometimes the paper and the pencil is not the right approach sometimes, but I guess sometimes if we're describing just that resistance, perhaps we really also as well need to really think about how are we approaching it? How are we engaging the person? Is there something in the way that we're not seeing or not attending to such that the person, it's difficult for them to engage as well? So, and I concur, just the poverty of thought sometimes. I've often find that just going out for a walk with somebody who may experience poverty of thought just allows us to speak in a very different way. That just helps bridge that gap a little bit too. Donna mentions building a trusting relationship, chit chat with a client, beautiful. We learn a lot from common chit chat, I agree. Terry says carry over from assessments rather than any labels. People are usually open and honest about themselves and resistance goes away. Thank you for that. Tracy says it's difficult, as Sharon said, that clients' perceived skill don't match ability function, challenging when discussing outcomes of assessment, as you don't want to focus too much on the problems. And I think for most of us too, we sometimes, when we see those deficits, we want to try and make ourselves feel a little bit better. And that's true of all of us, but maybe, maybe just focusing on a small goal that the person's interested sometimes can be helpful. Except that the nature of many persons' conditions will be more of a barrier than sometimes and other times. Curiosity about taking the time to know about talent, strengths, and life experiences of folks. So this next slide really, I guess, calls us to celebrate our progress, the progress of the person and the successes regarding the change and the willingness to engage in rehabilitation. So I think that's an important aspect, that sometimes pausing and saying those things is not easy sometimes in that busy practice. Progress regarding your own ability to do good dynamic, systematic, and detailed strength-based assessments, reflect on practice and engage in the client in process. And finally, find support in people with expertise to nurture your own assessment techniques and processes. So really this slide is just speaking to the fact that many of us are learning, and we're learning to do a good job, and just acknowledging that strength and acknowledging the accomplishments of both ourselves and people delivering services. Okay, so move to the next slide. I just want to spend a moment on this, and then it's over to Darren. Thank you for organizing me there. I'm trying to hide the dog. So best practices for assessment involving the client in all aspects of the process while developing trust. And I think you've all said that again and again. So that's certainly a best practice. Do assessment in places where people live, work, learn, and play in order to better understand function and context. Michael beautifully said that as well. Be aware of possible cognitive challenges and their impact on function. And I think what we're saying in this presentation is that sometimes it's hard to be aware of all that nuances that result as a result of the cognitive challenges, but just trying to dig down, trying to understand better is important. being aware of possible impact of trauma, and somebody beautifully talked about just maybe that somebody's situated experience and that it's difficult for them to move out of that. So providing trust and support. And in the last session, I think somebody mentioned just that unconditional positive support, an essential tool. Attend to cultural issues and use evidence-informed assessment and processes. And finally, be reflective of the dynamics of the interview process. And just looking at the comments here, I know that, that you are indeed extremely reflective of your own process. So with that in mind, I am going to just hand this over to Darren. I'm going to say warm welcome to Darren. And we are thrilled that you're with us, Darren. He's just going to get his, there you go, there he is. Welcome, Darren.
Hello.
So Darren,
hello, everybody.
I know that, Darren, I'm not sure your mic is on. Can we just have a double check there?
Yeah, can you hear me?
No.
Is anybody, are we having troubles with my mic over there?
Okay, so we'll probably just come through.
How's that?
Fantastic. I thank you so much. So Darren, really appreciate you giving this your time and your effort, and I know you've really prepared very well for us today. I thank you so much. So welcome.
Well,
Darren.
thank you for this opportunity. It's a great honor to be able to be here today and share with you guys a little bit about strength-based assessments and a case study. So as Regina said, my name is Darren, and I'm going to be able to shed a little bit of light on strength-based assessments by taking you through case study. So introducing you first with Rita. So with the task in mind, I've laid out a diagram here to showcase how this presentation will flow. As you can see here, upon introducing you to Rita, you will recognize that she has been referred to as, with specific goals in mind. Through Rita's story, I will showcase two different strength-based assessments and present a process of choosing tools, engaging a person's okay, so we're going to be presenting a process of choosing tools and engaging a person using these tools so that we can best suit the individual's strengths and needs. So notice I said process. Throughout this presentation, you'll see key messages being brought up. These key messages include that strength-based assessments are a process, so they are dynamic, that we might have to revisit the assessment as goals might change throughout the time. They're also it's also important to use person's words, as Regina has already mentioned, and that strengths-based assessments can really allow for a person to develop readiness as well. All right, so I'm gonna move on to the next slide here. See if this works. All right, so introducing you to Rita. Rita is a young woman within her early 30s. She is passionate about her family, work, art, faith, and helping others. Rita has spent numerous years in and out of the hospital receiving different diagnoses and experimenting with different medications. With a history of mental illness in the family, in addition to experiencing the trauma of losing loved ones as a result of mental illness, Rita struggled to find hope in her own recovery. It wasn't until she accepted a bed in a respite facility that Rita was able to engage her recovery in a personal and meaningful way. Learning of what the clubhouse could offer, Rita was excited and eager to engage in her own recovery through the opportunities made available in this person-centered environment. Adiko says the slides are not available or visible. Is anybody else having problems with that? No? Okay. Oh, Michael says there's problem on both his PC. Okay, all right, I'll carry on. All right, so now I'll take you through a bit of the assessment process, building building a rapport to selecting a strengths-based assessment. So feel free to go through the slides here. I won't necessarily read out every point on there, but I'll be adding information to that, so go through as you wish. I'll be attempting to apply Rita's story throughout the remainder of this presentation, and hopefully that will be helpful for you guys. All right, so after Rita was referred to the clubhouse and settled in a bit, she expressed interest in a young adult psychoeducation program that I was facilitating and through a series of engaging interviews, Rita's main focus and goal of recovery was communicated. She wanted to pursue as many opportunities and resources that would help her in her process of recovery. A more immediate and direct goal was how to help her manage stress, as well as coming up with possible solutions dealing with family conflict before quickly approaching family visit. With time as a constraint in her initial goal, addressing her expressed interest was important, not only in developing a rapport but also enabling her strength of motivation. I decided to introduce to her a dealing with psychosis toolkit, which was developed by the Fraser Health Authority, and Rita identified her desire to work on chapters dealing with managing stress and problem solving. While exploring stressors, it became apparent to Rita that her family visit was only one of the stressors in her life, and that she would like help dealing with. So, having returned from a successful visit with her family, Rita was more eager than ever to address the other stressors in her life. At this point in the process, I asked Rita if she would be willing to engage in a strength-based assessment that could help bring insight in her readiness, functioning abilities, and her environment, while still keeping in mind the goal of recovery and managing her stress. So Rita agreed, and we began to go through the client's self-appraisal of needs and interests assessment, which is a strength-based assessment developed by Coastal Mental Health with the help of peer support, family members, and occupational therapists. So I'm going to be going on into that now. So this slide, it's pretty jam-packed in there. It's a bit of a cramped version of the client's self-appraisal of needs and interests, and as you can see there are 29 different categories ranging from housing, money, physical health, mental health, activities, work, transportation, spirituality, etc. So the strength-based assessment provides an individual with the opportunity to express needs, interests, assets, and strengths, which you can recall from Regina's slide, are all integral within the parameters of the strength-based assessment. I'm just looking at the notes from you guys here, if there's anything that's going on. Okay, so they're good, clear. Okay. If you'd like to try to use this assessment in your own practice, I encourage you to go through all 29 different categories with the individual that you're working with. It can be easy to lose one's focus, as we talked about struggles with assessment. It can be easy to lose one's focus and turn this into a needs-based assessment. Therefore, it's very important to utilize your PSR and reflexive dialogue skills to encourage the individual to engage in not only one's needs, but also in their interests, assets, and strengths for each of the categories. The assessment has the potential to shed a lot of information about your client, positive information and concerning information. It is important to ensure that you as the facilitator allow for the individual to use their own words and to come to their own conclusions of what their needs are. So this slide is just I won't really touch on it as Regina's already gone through that, but when you guys look back in your when you guys look on the AP, the Advanced Practice website, you can just be reminded of the importance of the assessment process. All right, so here we have a few examples of Rita's expressed needs and interests, as well as her strengths using her own words. So I've just taken 3 of the categories from the self-appraisal of needs and interests, and I'm just going to go through this slide here with you. So the category is supports, first one here, and is there a need? Rita expresses, yes, there is a need for her sister to understand her mental health needs and to show support, to be a part of and engage in a support network, and also have her adopted family be more active and supportive, to be able to interact more with those who can relate to understanding of her needs as well. Is there an interest? Yes, there is. And the interest in her strengths and assets can be described in below. I think I have a pointer. Yeah. So, right. Let's see. Right here. Okay. So you can take the community. Some of her strengths are she can take community and relationships groups. Very aware of her. She's also very aware of her mental health. She's good at communicating. She has people in her life who say that they care and want to be there for her. She has a lot of other supports in place already, which could help bridge the gap. Here's another category that she talked about that was important for her, and that was around activities. Is there a need? Yes. The need is to make a weekly plan. Is there interest? Yes, there is. And the strength that she has currently is that she's working with the occupational therapist to break down her weekly plan more, and she also has accountability from friends. Her leisure. Okay, so her leisure is there a need? Yes, it includes more fun time in her life. And then is there an interest? Yes, painting, writing, and stamp club. So strengths and assessments. So she's arranged to meet with a peer facilitator of a clubhouse painting program, and she can attend a creative writing program at the clubhouse, as well as help with the clubhouse newsletter. She has a desire to feel. She has a desire and feels called to write a book of her own story, and she also attends a monthly stamp club and is building up a collection of supplies to be able to create at home. All right, so moving on to the next slide here. This slide showcases the priorities. So after going through all 29 different categories, individual is then encouraged to look at what the priorities are within their life. Rita indicated in her own words that 5 out of the 29 categories presented in the CSA were areas of strengths without needs. With the assistance of motivational interviewing, Rita was able to articulate her needs, interests, some strengths, and assets in the remaining 24 categories, as we've just explored a little bit with those 3 examples. Where Rita became overwhelmed was trying to prioritize these needs and set 3 categorical goals. So using this sheet here. And this posed a challenge to both Rita and myself, and it would be counterproductive to proceed with more than 3 categorical goals. I then asked Rita to revisit each of these categories with the assignment of looking for common themes. Rita came to the conclusion that time was a constant throughout the assessment. This was interesting for both Rita and myself, as Rita appeared to have a good handle on time, as she already kept an in-depth schedule book of appointment programs and tasks to do, and was constantly revisiting it. So let's see, with this new realization of the number of needs presented in all of these categories of the CSE, Rita's recovery goal was becoming daunting. So she found herself quite frustrated and overwhelmed by the limit of time. So Rita wished to redefine her goals. This kind of explores the dynamic process of the strength-based assessment. So to explore personal usage of time, this is her new goals: to explore personal usage of time, seek balance, and find meaningful activities. So at this point, I was aware of an additional strengths-based assessment by Terry Krupa and all that explored these very topics. So I asked her to take a look at the assessment and decide if she would like to move on to a new strengths-based assessment that, in my opinion, dealt more directly with her redefining goals. So I'm going to move into the action over inertia here. And Sharon, you asked a question earlier where Gina said that I might be able to touch on that a little bit. I think this tool really helps address that question. And it might be too far up for me to scroll back up there and repeat that question. Let's see, I'm just going to try. Okay, so this is what Sharon says. Persons may not be the best self-reporter. Example, of course, I can go to school, but in reality, they struggle to get out of bed this morning to come to this appointment, and it's hard to make the small steps to go to make the school goal. So I'm just going to go through the process here that I went through with Rita, and that might be helpful. Unfortunately, my slides here, the tabs got a little messy there as it's trying to fit in the screen. But what's important here is, let's see, what's important here is that we see that this is a daily time use log. So moving into the action over inertia. All right. So we'll look at 3 different assessments that helped readers further identify strengths and make attainable goals. First, we'll look at the daily time use log as shown on this slide here. From there, then we'll look at the information gleaned in the log, and we'll then be able to proceed with the following assessment. The next assessment provides a visual of time spent within 4 categories. We then take a look at finding meaning in activities, and finally, we will explore questions to gauge one's satisfaction in activities. On the slide here, we have a rendition of the daily time use log. The actual log takes place over 24 hours and uses 30-minute intervals to ensure precision. So the challenge I posed to Rita was to compare the daily time use log to her weekly schedule. She was, and this helped her realize then that she was not accomplishing the goals that she had set out to do. Sometimes the mental preparation for the activity was mistaken for fully engaging in the activity. So Rita now realized that she was spending most of her time watching TV or sleeping. Though there was glaring areas that need change, there were moments in her weeks that Rita felt great about herself. All this proved as extra motivation, essentially developing readiness to make these changes. Rita then insisted that she could achieve more in a week and wanted to continue examining her days throughout the following weeks to see improvements and establish balance. Oh, at least can't see what people are typing. I don't know. Matt, can you address that? And as I go on to the next slide. All right, so here is a slight adaptation to the daily time use graph as seen by a typical day in Rita's life. When beginning this assessment, oh yeah, so this is just at the beginning of the assessment, and as we carried on, Rita found that she wanted to keep exploring the daily time use log and see the balance and change as that took place. So this visual helped Rita recognize that areas of her life she would recognize areas in her life that she would like to change and strengthen. So this again proved helpful in creating SMART goals and developing readiness. All right. Here are a list of values that a person might be able to attribute to their reasons for engaging or avoiding activities. So this tool proved helpful for Rita when exploring why there were certain appointments and daily tasks she was constantly missing and why there were some activities she consistently accomplished. Yeah. So I encourage you guys to look back over this this slide. You'll see that yeah, this could be helpful in your guys' own practice. It really just goes through categorizing different values and putting your personal like whether you think it's important or not, and that really helps with looking at activities. All right. This final assessment shows a list of questions from the worksheet, Satisfaction with Activities. And feel free to look at, you know what, I originally had Rita's responses in here, but I took them out. But so examining the activities that that Rita was avoiding and the activities that she was following through with, she was able to further identify strengths and needs and make positive adjustments in her life accordingly. Excuse me. So goal setting was started to change for Rita as she was able to adjust how she looked at an activity prior to the series of interviews and assessments, and so guilt took over when an activity was not completed after the series of interviews. So activities seemed to take on a new life for Rita. New activities meant to serve a purpose, and whether she completed the project or not didn't seem to matter as much. For example, where Rita previously lacked measurable efforts when pursuing growing her own business, she then recognized that she was what she valued about the job was that I guess what she valued about the job was that she was holding. Sorry, let me back up just a sec. I lost my place in my notes here. Okay, so where Rita previously lacked measurable efforts when pursuing growing in her own business, she then recognized what she valued about the job was that she was helping individuals and communicating with individuals. So she applied this realization and these values, and she's actually taken on a new pursuit in helping in working in peer support work. So through the whole process of these different strength-based assessments, Rita was able to get a good handle on both or most of the 29 different categories presented originally in the client self-appraisal of needs and interests. And when revisiting the tools a year later, Rita was proud to showcase her new strengths and less needs. So she found herself managing time, setting attainable goals, moving into her own apartment, re-engaging family, managing stress, and as I just mentioned, even pursuing new and additional careers within peer support. It's pretty exciting. Thank you, Michael. All right, so that's it for me. I'm going to be turning it back over to Regina to highlight these key messages and turn it over to you guys for some questions as well. So, Regina, did you want to take over?
Sure. Hello again. Darren, thank you very much for an amazing presentation. How it is challenging to take a piece of your daily work and to squish it into 15 minutes. I know that you're a very caring person, and I know that it's hard. It's a real challenge to do that, Darren. So I congratulate you on the enormous task we have given you, and I think you have given us a real way to action the process of assessment and to let us see what a specific assessment would, those two assessments would look at. You gave us a little glimpse into that, and I deeply appreciate that, Darren. So thank you so very much.
Well, thank you for the opportunity. It was a pleasure.
So we will just, you're very welcome, Darren. We learned a lot by working with you, Matt and I, so thank you. We will just want to hammer home the messages, that the notion that assessment is a dynamic process. Darren, I think you highlighted that beautifully. First person came in with goals, and then things switched, and then she developed her own awareness, she developed her own potential, there was an opportunity for new change, and then you left us with a very upbeat story telling us that really her situation had changed significantly, and she saw new potential for herself. So really, I think tells us that it's a dynamic, the assessment is a dynamic undertaking, and that it's a process between at least two people. It really is a process between a whole team, in my opinion, people receiving services and family members, but that process, reflective process, when it goes well, it can do really well. that assessment, by the nature of assessing aspects, helps to develop confidence, self-efficacy, and contributes significantly to readiness. I think at one point as we were preparing this session, Darren, you shared with me that just through that relationship you and she had, she was able to think about new things and doing new things, and that she appreciated working with somebody who would listen and support her unconditionally. So they were not your specific words, it's my interpretation, because you're very humble. But what I think I'm really pointing to the fact is just that personal closeness contributed to her ability to see a future for herself. And finally, assessment findings should be recorded using the client's own words, and you certainly told us about that. And as Darren had mentioned, he had really itemized parts of the assessment, but not having permission from the client, we just thought it was better for confidentiality to not show that particular assessment. But it was clear to me that Darren was really working with that person's own words. So not that we knew who the person was, the name that we've used was a pseudonym, but we're just mindful of confidentiality. I'd like to just take a little minute before we take questions, and this information is helpful for us to really help us understand where this information landed for you. It's also helpful for us as a take-home message for us to sort of build our own awareness of how this information is impacting your practice. So it's a bit of an evaluation tool for us as well. So could we please ask you to type how you think this information may influence, consolidate, acknowledge, change your own assessment practices. So if we can please just do some sharing through the type box to just let us know how that information is going to land for you. So Barbara tells us that she will put it to practical use this week. That's wonderful. That's really wonderful. Dave says, helps us work with people to develop readiness. Thank you, Dave. Right. Documentation strength more comprehensively for a full term members to read. Thank you. Terry says, I look forward to using this tool for the initial assessment and term assessment. So perhaps the client assessment or perhaps the action over inertia information. Gives us practical skills for future. Great help with the combining of MI, work specifically with employment. But now I'll talk to clients more about their daily routines. Oh, good. And see how that's contributing to employment or lack thereof. Reflecting on how I should incorporate client's perspective in my assessment process and findings helps me to remember participant steers the helm and I'm collaborative crew member. Oh, beautifully, James said, as always. Will be any more sessions? I will speak to that in a moment. Absolutely, Cheryl. When a person is referred for peer support, we'll be able to consider if they have participated in best goals for our assistance. Best of their present ability. Okay, good. Good reminder of client as the expert, assessment tool that I can learn while try practice. Thanks, Connie. Consistent with what we teach here in Nova Scotia to folks working in mental health practice and settings. Woo, awesome. Inspires me to consider assessment delivery, read pen and paper. Thank you, Susan. Good, wonderful comment as always. All right. So just with that in mind, I apologize. This slide has went a little, just lost its formatting as well. But we talked a little bit about the values of strength-based assessment. I'm going to look at the comments afterwards, so I really appreciate you just trying to think about how you're going to apply that. So while I'm not addressing all of your comments at the moment, certainly Matt and I will look at them afterwards. So if you don't mind continue to type, I appreciate it. Just going to let you know what we did talk about was the value. We described the best practices and the challenges and concerns regarding assessment. We applied the strength-based assessment process to 2 tools of a case study, and we identified how this webinar may influence your own assessment. Important to note what we didn't do. We didn't really talk about assessment with regard to illness or diagnostic categorization. We didn't think about traditional assessment of specific symptoms such as mini mental status exam or the PANS positive and negative syndrome scale. So we didn't look at that information, and we really didn't consider suicide assessment or assessing risk and protective factors. I put that in quotations because I think some of our good new suicide assessments really do look at it as risk through a strength-based approach. So just wanted to pull that out. But just to be clear about what we didn't do. I've given you a host of references. I know it's a lot of information there, but I hope they're useful. And now what we'd like to do, we probably have about 4 minutes left. I'd like to open it for questions. I appreciate all your comments. I'm not going to address it now. But if you could just, if you have any questions, we have about 3 minutes to take a couple of questions at the end.
And maybe we can just take this opportunity as well, just to let everybody know and remind folks that there is an evaluation of today's webinar session that's going to be sent out. It'll be coming out early next week in email to everyone who attended today. So there will be a link to participate in the evaluation survey. And we really do appreciate all your feedback. We've compiled the feedback from the earlier sessions, and it's all collated into a really easy to interpret format. So we've been using that feedback to improve the next sessions, and we continue to do so. That same email will also, of course, include a link to your downloadable certificate of attendance, so you can get your continuing education credits, and that will be customizable. So for those who are attending via somebody else's login on the same computer, everybody will get the credit for attending today's session. So thank you, everybody, for participating, and we look forward to connecting with you again regarding the evaluation.
I just also want to say, while we're on that note, I think you're probably aware, upcoming Psychosocial Rehabilitation Conference in Toronto, September 22 to 24. Really encourage you to come if you have the time. I know it's expensive and a long way, but a little note to the wise. 2015, Vancouver will be hosting the next Psychosocial Rehabilitation Conference. So keep tuned. If there are things that you want to talk about, present, do let us know. Also, in terms of, somebody asked earlier on about upcoming webinars, this is the end of our summer presentation. We're developing 3 for the fall, so stay tuned. We're probably looking at wellness. We may be looking at peer involvement. So we're just in the preliminary